So what are life science companies already doing to solidify their environmental reputation? What are the practices that they can use to be more replicable? So life science companies have a lot of factors they have to balance all at once. Health of the patient, equitable healthcare for society, as well as health of the planet. And while certainly much of the focus is on health of the patient as well as equitable healthcare for society, there's a great deal of attention that the industry has on the environment that really largely goes unrecognized. Biopharma companies, for example, look at how can they make manufacturing of treatments greener. Can they use less water for cleaning by scaling out their process, meaning having that process run several times in parallel, or by scaling up that process into a larger bioreactor? Is it more sustainable to use large stainless steel tanks that need to be cleaned, or is it more sustainable to have smaller batches that utilize single-use materials that don't have to be cleaned? And as we've seen during the pandemic, companies also asked, can we produce these treatments and vaccines much closer to the patient, thereby avoiding the CO2 emissions it would take to ship that treatment around the world or to the patient themselves? We've also seen during the pandemic the emergence of telehealth and digital approaches where patients can get treatment from home without taking a long, time-consuming and CO2 emitting trip to see their doctor or to visit the hospital. Secondly, medical device companies are completely rethinking product design. They're very much looking at life cycle assessment early in the design process, and in particular, looking at how they can reduce plastic waste in packaging, as well as how they can increase the use of biocompatible, eco-friendly plastics in the devices themselves. And finally, both the medical device companies as well as hospitals are reevaluating how they can reuse, refurbish, and remanufacture equipment. This lowers the amount of medical waste that needs to be disposed of, and medical waste needs to be disposed of in very careful manners that are not necessarily very sustainable. So if we can lower the amount of medical waste that we generate, we're lowering the amount of CO2 emissions from putting that not only into landfills, but also burning it in certain cases. But it also ensures that we're able to deliver healthcare much more equitable to the overall society.